Friends, today I am going to demonstrate the HoLEP procedure for BPH. This elderly patients, approximately 65 years of the age, had severe voiding dysfunction, the acute urinary retention, underwent TURP approximately 6 months back by some urologists. Then the patient came with the complaint of dribbling of urine, straining while passing urine, and painful urination. On evaluation, urethrocytoscopy was done and found that the partial resection of prostate, which is right lobe, was resected partially, and there is synechia, and the bladder neck is divided into the upper and lower half by the synechia. So the plan is to do the HoLEP, Holmium Enucleation of prostate. For that, especially, it's very important to know the setting of the laser. That what I'm going to use for that patient is 550 micron Holmium enucleation fiber that is properly striped, as well as after the fiber, the setting will be, in this particular case, will be starting from the 45 to 50 watt, using the 1.6 to 1.8 joule and approximately 30 hertz frequency, with the pulse width somewhere in the middle. So with this setting, I'm going to start the procedure. So enucleation, we know that is the standard, and HoLEP is the new gold standard in the 21st century. So in 2026, the HoLEP Holmium enucleation of prostate is the only standard treatment provided. There is availability of the 100-watt laser machine, which is very important, especially the Holmium, as well as the expertise of the urologists as further. Both are very important. Now coming to this case, I am going to do the enucleation first marking. Marking is just at the apical area near the veru, starting from the 6 o'clock to the 12 o'clock in both the sides. And again, there is creation of the gutter at 12 o'clock so that the enucleation will be comparatively easy. During enucleation, my aim is to get very soon in the area of the capsule, to expose the capsule so that we can get the avascular plane, and finally proceeding in the avascular plane will be always very important, and we can enucleate the lobes very fast. The enucleation process will go from 6 o'clock up to the 12 o'clock in the both the sides. And in this particular case, the left side, there is the resection was not at all done. So the enucleation will continue, and finally the lobes have been enucleated. The residual lobes in the right side was also enucleated, and finally both the lobes are placed inside the bladder for the morcellation. Morcellation, we know that is last and very important step in the process of HoLEP, and for that there is good quality of suction apparatus should be required, and morcelloscope along with the morcellator is very important. I am going to use the unique med hand operated morcellator along with the Wolf morcelloscope, and finally the morcelloscope has been negotiated and suction is started, and finally we can able to morcellate entire lobes, and finally the voiding was checked and 22 French 3-way catheter placed in. The urine is completely clear and there is no need of the traction or irrigation. We usually put the patient on irrigation for 3 to 4 hours, and finally it has been withdrawn in the same day. So there is no traction, there is no irrigation, and even the bleeding is almost nil. So it is very suitable for patient having the bleeding diastasis as well as the coagulation disorder. This is very important. So in those patients, again, the HoLEP is treatment of choice. So this is all about the procedure. Thank you.